Hi, and welcome to the We Honor Veterans Veteran Issues at the End of Life Veteran Volunteer Training. This will encompass several issues and solutions that will be necessary for any volunteers working with veterans to understand when dealing with a terminally ill veteran. Main goal of this training is to gain the appropriate knowledge that will help the veteran volunteers to best support veteran patients and their families. Please note that you can always contact your volunteer manager at any time if you begin to experience overwhelming or stress in your life. We hope that you will be able to describe why it is important to improve our knowledge and understanding of veterans' needs, describe how we can best meet the needs of veterans and their loved ones, and list 4 unique issues that veterans may face at the end of life. Veterans in the United States number around 26 million. This large number places 1 in 4 adult men as being a veteran. 1,800 of these veterans die each day, but the VA cares for a minority of these veterans, which adds up to being less than 4% of veteran deaths occur in a VA facility. Your commitment to serving these veterans will support our organization's goal of providing care for veterans at the end of life. First and foremost, not every veteran will have unique needs, so we must make sure that we do not make assumptions based on the title of veteran. Many influences can shape a veteran's ideals, beliefs, and demeanor. Combat and non-combat experiences both influence a veteran's needs. Their needs may be equal for either case, but assumptions of combat veterans having more expensive needs while non-combat veterans have little to no needs is unrealistic. The paranoia and stress placed on a non-combat veteran could be the initial onset for specific needs that the veteran now requires. The magnitude and time spent in a specific war is a major factor in determining the needs of veterans. More than likely, prisoners of war, or POWs, may have experienced a higher level of trauma from their war experience, which could increase unique needs of that specific veteran. Those veterans who had or currently struggle with PTSD may require a more extensive level of support in relation to their needs. Depending on the war or conflict that the veteran took part in, the specific branch and rank may have suffered more casualties during the war, which could be an indicator of increased special needs. And while enlisted, veterans may have specific needs. Drafted veterans may be bitter about their forced military service. This variable could require increased needs from drafted veterans, but it may also make the task of supporting that veteran slightly more difficult. Veteran volunteers who work with terminally ill veterans may have distinct advantages in caring and supporting for these veterans. The unique military training and skill set that veteran volunteers bring to their hospice work is invaluable. The common language, terminology, cultural bond, and similar code of conduct and honor allows for the perfect gateway to be opened between veteran volunteers and veterans being cared for by hospice. A level of trust is established, which will allow for veterans to feel more at ease with the various levels of care that the veteran volunteer offers. This also allows us to open up the opportunity for our volunteers who may not be veterans, and this training allows for them to understand the issues that might happen at the end of life. As was mentioned earlier, veteran volunteers will be exposed to a multitude of veterans with distinct background experiences. While war is fought with the hopeful outcome of peace, the lifelong scars that these terrible events leave can come to the surface when a veteran becomes terminally ill. The outcome of any armed conflict holds not just the promise of peace, but also dark, terrible revelations, questions of justice over the vanquished, and for far too many, the confronting of personal loss. From the Veterans History Project. The military training that men and women receive revolves around a central idea that emotions are a weakness that can compromise the success of a mission. With this, soldiers are taught to suppress any emotions that show fear. Many veterans who have had to practice this military cultural norm in a time of war might find it fitting to practice the same technique when faced with the end of life and death. Some of these influences can be a promotion of stoicism. Fear and admitting pain can be seen as a sign of weakness due to these cultural standards set by the military. Many positive factors can allow veterans to build upon their war experiences, which will then allow them to be a productive member of society. A natural resiliency to hardships and strong family support coupled to form the basis of positive factors that can help veterans integrate back into society. Also, if a veteran feels that he or she successfully accomplished the mission, this can be used to instill confidence in all daily activities. While many tend to remain silent about their war experiences, some feel at ease about after revealing their experiences. Post-traumatic growth is defined as the positive psychological result due to a traumatic experience. This positive growth can occur because of new revelations that are realized by those who experience traumatic events. For example, when a soldier narrowly escapes death on the battlefield, he or she may find new beauty in the smallest things that life has to offer. The veteran may learn to cherish things that were once taken for granted. On the other hand, traumatic combat experiences can lead a veteran in the opposite direction. Anger, lack of concentration, and substance abuse can be results of such experiences. Also, post-traumatic stress disorder can occur from the war experiences that a veteran has been exposed to. Please note that these factors can be exacerbated due to the end-of-life issues and challenges facing a veteran. Since PTSD can sometimes be one of the most difficult factors to deal with involving veterans, a clear description is necessary to understand the factors of the disorder. After a veteran has been exposed to a traumatic event, the event can continue to occur in the veteran's mind for the rest of their life. The reoccurrence leads the individual to constantly avoid any stimuli that can be associated with the trauma that was faced. PTSD can take several forms, including acute, chronic, or delayed PTSD. Although it is difficult to predict who PTSD will affect, when diagnosed, immediate treatment is the best approach to successfully dealing with this disorder. Deborah Grassman identifies three main approaches to dealing with PTSD. The healthiest approach is to seek help, which will allow for integration and healing. Incomplete integration occurs when PTSD is prolonged for various reasons. Lastly, a veteran who suppresses war trauma may seem to not struggle with PTSD, but the effects of war linger, while the suppression can also result in a delayed onset of the symptoms of PTSD. These statements show some effects that trauma can have on a veteran. It is very important that you, as a veteran volunteer, remember the most important guidelines when dealing with other veterans. These include listening carefully to anything that the veteran says, expressing sincere appreciation for their service, celebration of their accomplishments, and affirmation of the wisdom that the veteran has gained, which may leave an impact on your life. If you hear any of these statements or notice any of these symptoms, please notify your volunteer manager at the next opportunity. From there, the volunteer manager will get in touch with the rest of the team and set up a plan of care with a social worker to help it out with these needs. When you come in contact with a veteran who has incompletely integrated their experiences, remember to proceed gently into the conversation with your veteran. Offer general statements and questions that will allow the veteran to answer. Remember that patience and a calm atmosphere will be positive factors that may help the veteran to open up to you. Don't make any sudden movements or touch unexpectedly. Those who have incompletely integrated may register any sporadic movements as a stimuli that can re-stimulate them. As a veteran volunteer, you have a very important advantage in dealing with other veterans. Through your service to the country, you have been exposed to things that will allow you to form camaraderie with other veterans. And as a volunteer who may not be a veteran, you can still offer this type of camaraderie and socialization that they might need at the end of life. With this, always remember to keep the focus on the veteran and don't become overly pushy in your attempt to get a veteran to answer questions. Guilt can be one of the biggest issues that a veteran deals with after returning from war. Some general statements to avoid when dealing with veterans include, "Did you kill anyone over there?" And "Did any of your friends die in the war?" These questions can trigger guilt or anger that the veteran has been dealing with for a number of years. If the veteran is willing to disclose this information, be prepared to listen, but don't try to pressure the veteran into disclosing any stories of death. When dealing with a veteran who has suppressed traumatic events, allow for the same interventions and care as veterans with incomplete integrated trauma. When performing interventions with veterans, remember to make the environment emotionally safe. Also, while affirming the feeling aspect of their conversations, remember that stoicism may interfere with the progress that you are trying to achieve with the veteran. Many times, individuals tend to associate veterans with masculinity. Recognize that women veterans are quite prevalent and may have experienced the same level of trauma as male veterans. Remember that assumptions are counterproductive in the process of helping veterans. Don't allow yourself to believe that a veteran's history necessarily places that individual with other groups of veterans. Each veteran's war experience is different and should be treated delicately and without prior assumptions. In an effort to help celebrate the veteran's military service, ask the veteran if they would like to be issued new medals and awards. The process of replacing the medals will allow for you to gain new knowledge of the veteran's service, while also allowing you to show your gratitude for the veteran's sacrifice. Hopefully, through the specific approach outlined, you'll be able to build a strong relationship with the veteran. This can lead to a greater success in the veteran opening up to you. This may include frequent visits to hear the patient reminisce, which may lead to the production of a videotape or memory book that will document the veteran's life story. Please note that before completing any of these tasks that require recordings or pictures, that you get a consent form that needs to be signed by the patient and family as well as yourself. Some volunteer services that you can provide for our veterans is making regular volunteer visits, giving them a phone call to check in and see how they're doing, and provide respite for family members and caregivers. A great opportunity to show appreciation to veterans is on Veterans Day. Your volunteer manager may ask for you to help out with visiting different facilities on that day for their celebrations. And as a veteran, you might be asked to wear your uniform and assist with pinnings. In closing, we hope that you have learned a lot more about veterans at the end of life and some issues that they may be facing. Know that your volunteer service will have a lasting impact on our veterans, as well as their families. Thank you so much.